My name's Dottie and I live in the small community of Brush Creek near Leola. I'm a special education teacher at Glen Rose High School. In the summer of 2015, I started just feeling really tired, and I called the doctor. I said, something's wrong. I said, I'm so tired I can't function. They admitted me through the emergency room and they gave me 2 units of blood. Between August and December, I had 12 blood transfusions, and so finally we told them we need a referral to UAMS.
Dottie was feeling well, just feeling tired when she saw me. She was still working full-time as a special education teacher, just needing blood transfusions on a weekly basis. A bone marrow biopsy was done, and that diagnosed her with an aggressive form of leukemia called chronic myelomonocytic leukemia.
So we went in and we saw Dr. Veraputhrin, and he told me that I was going to have 3, probably 4 rounds of chemo and then a transplant. And I was very lucky because they had just started doing transplants in August of 2015. Otherwise, I would have had to go out of state.
The myeloma transplant program and the allogenic transplant program together form the UAMS bone marrow transplant program, the only transplant program in the state of Arkansas.
When somebody refers to a bone marrow transplant, it could either be a transplant that you get from your own stem cells, which is called an autologous transplant, or a transplant that you get from a donor's stem cells, which is called an allogenic transplant. And we do both of those at our facility here for various conditions, mostly leukemias and lymphomas and other blood disorders which would otherwise be very difficult to cure.
When someone needs a allogenic bone marrow transplantation or a donor-derived bone marrow transplantation, first of all, we look into the family to see if there is anybody in the family who's a match for the patient, like especially brothers and sisters.
They tested my sister and she didn't match, and then they tested my brother and he was a perfect match. When I found out my brother was a match, it was just total relief. It was like, it's gonna work. It was just like, this will work. I'm gonna be okay.
My sister told me I was a match, and I was really relieved that it was such a good match, that it looked like it would be successful.
We do make sure that the donor understands what they're going to go through, that the donor is willing to provide the stem cell, and that the donor is healthy enough to provide the stem cells. And the process really entails stimulating their bone marrow with growth factors and then putting in either a line or a port close to their neck and putting them on a machine, sort of like a dialysis machine where the blood goes out and the stem cells are filtered out and the rest of the blood goes back in the body. And these stem cells are then used, often fresh, within the next day or so for the recipient or the patient.
My sister just asked me about to be tested for this because this is the procedure you go through to be the one chance to get cured. This is the current thing. You know, there's no question when you're faced with something like leukemia, you know, you're just gonna do it.
And on April the 20th, I had my transplant, and I stayed in the hospital, I think 20 days after that.
It's a complex process because it doesn't end once the stem cells are infused. And so then begins the process of monitoring them for the first month or so in the hospital and very closely for the next 60 days, with a total of 100 days about, near our centers.
The bone marrow transplantation is a very complex process, and it needs lots of resources. And not every center can do this type of transplantation, as you can imagine.
My transplant team, which includes the E7 unit, the infusion 4 nurses, my clinic nurses, APNs, transplant coordinators, social worker, care manager, the cellular therapy unit, as well as my colleagues.
The way they run the program and they keep you so informed and they give you so much information and they tell you the things that you need to know and the things that you need to keep track of, the nurses would explain, now this is this count and it should be at this level and this is what your level, but they would always explain it to you so you would understand in layman terms, so you would know what was going on.
As a transplanter, the greatest accomplishment of transplant is not just the patient being in complete remission, but also able to do what they like to do in their life, what they were doing before transplant. And in the case of Dottie, the fact that she was able to go back to work full-time 6 months post-transplant is a great accomplishment. This gives me immense satisfaction and pride in what we as a transplant team do at UAMS.
Over the next 5 to 10 years, I hope that we can expand our program and have more staff as well as resources to be able to do and help more patients around the state of Arkansas.
We perform around 30 allogenic transplants a year for leukemia and lymphoma, around 50 autologous transplants for lymphoma, and approximately 300 to 350 autologous transplants for myeloma. The myeloma program is world-renowned for their innovation and superior outcomes. The allogenic transplant program at UAMS is relatively young, around 3 years old, and we are growing every year, and I'm projecting approximately 60 to 70 allogenic transplants a year in the next 3 to 4 years.